Hi everyone. Now we are going to see about eating disorder. So, what is eating disorder? Let's see the meaning for that eating disorder. Eating disorder or complex mental condition, health condition that which affect millions of people worldwide. They are characterized by abnormal eating habit that can have severe impact on their physical health, their emotional well-being and overall quality of life. The primary step of eating disorder includes anorexia nervosa, bulimia nervosa, and binge eating disorder. So, each with distinct characteristics and challenges. They all have their own characteristics and challenges. Next, we are going to see about anorexia nervosa. So, what is anorexia nervosa? People with anorexia nervosa greatly restrict food intake and calorie intake, sometimes to the point of self starvation. They used to starve their self starvation is more in this anorexia nervosa. So, they have anorexia at any body size, even zero size. It is characterized by an obsessive desire to lose weight and a refusal to eat healthy amount of food for your body type and activity level. Next we'll see what is bulimia nervosa. So bulimia nervosa is people which diagnose with this eat binge eat or a perceive they eat large amount of food over a short time. Afterwards, they may force themselves to throw off their calories by vomiting or using lactatives or exercising excessively to rid their body out of food and their calories. So next we are going to see what are all the symptoms which eating disorder clients or patients have or face. First symptom is mood swings. They have shift in their moods. Almost in all times they have swings. Next they feel fatigue, they feel faint and they also feel drowsy or dizziness. Then they have very thin hair and may they have hair loss also. This hair loss is because of lack of nutritional food intake and poor health habit. They use frequent bathroom breaks after eating. Once they have their food, they will go to bathroom. They feel so. Unexpected or unexplained weight changes or drastic weight loss. They have very drastic weight loss. Unusual sweats. They get unusual sweats or heart flash because of lack of food intake or unhealthy diet plan or diet intake. The complications of eating disorder. So, eating disorder or second most leading psychiatric disorder followed only by this using disorder. Greatly restricting calories, throwing up, or extremely doing exercise can take a toll of your whole overall health. An untreated eating disorder places at risk for serious problems such as anemia, heart attack, and other heart problems. And acid may like gastrointestinal problems and low blood pressure, low blood sugar, failure or brain damage, nerve damage, osteoporosis, and tooth damage, arthritis problem related to bone health. Then they have severe dehydration. They don't have a balanced water in their body, and they almost all time have constipation problem also. Stopped menstrual cycle. If a female, they would have faced menstrual cycle have stopped much more early in the age, and They are mostly infertility patient. The proper egg formation will not be there in that particular patients, and they usually get stroke easily. So what are all the treatment we have for this anorexia or bulimia nervosa or eating disorder is psychotherapy, a mental health profession that can determining the best psychotherapy for your situation. So many people with eating disorder improve with cognitive behavior therapy, which we change the belief of irrational belief to rationalizing. This form of therapy help you understand and challenge thinking pattern and drives behavior and emotion together. So, this form of family therapy helps parents of teenager with anorexia. Parents actively guide a child's eating while they learn their healthy habits. Nutritional counseling, which is like a registered dietitian with training in eating disorder, can help improving eating habits and developing nutrition meat plans. So this specialist can also offer tips for their grocery shoppings, meal planning and preparation. Thank you.